Hey, Dr. Tyler Williams with Better Sleep SLC. Thanks for checking out this video today. Sharing some thoughts and some research on best times of day to eat and how it could impact your sleep. So one thing that's been gaining a lot of popularity the last few years is melatonin. And melatonin is something that your body naturally produces, but sometimes if you can't sleep, you'll take some extra melatonin. Well, there's research to say that when your insulin or your glucose levels spike, then that can actually decrease your melatonin. So what that means is if you eat late, that could actually suppress your melatonin that your body naturally creates, which can affect your sleep cycles. So when you're planning your meals, it's best to eat inside of a 12-hour window and to start eating about 1 to 2 hours after you wake up. So for me personally, adopting this is I'll get up and I'll work out. Now, sometimes I'll have add some powder to my drink with some creatine or some vitamins or supplements. But I'm not eating breakfast until after my workout, which is going to usually be an hour and a half after wake up time, or maybe a little bit more, an hour and a half to 2 hours. And then you want to eat all of your meals inside of a 12-hour window. So in my case, if I get up at 5:30 and I'm get ready and dressed and go to the gym and back, now maybe it's 7 or 7:15. If I have breakfast at that time, then I should be finishing my meals by about 7:15 at night. Now, don't be too hard on yourself for these rules, but just kind of use that as a guideline. Is stick with inside that 12-hour window and eat 1 to 2 hours after you wake up. It's also important after your last meal, which is dinner, that you avoid all of the snacking. Again, those snacks tend to be lower quality foods that could actually disrupt your body's natural melatonin. So another important thing that's become more popular in the last few years is protein, and something that you should meet with a dietitian or a nutritionist or your physician on about types of protein that are best for you. But for me, I'm trying to consume a higher protein diet. And so that is helpful for me because it makes me less hungry than if I eat lower nutrition foods. So by eating protein and vegetables, I'm full longer. And also because I'm up and working and moving and in the clinic and seeing patients, that helps a lot too, because the time for snacks just isn't there. So I would suggest planning some things throughout your day where you're away from your pantry, especially as the day gets later, because that could really throw off your circadian rhythm and your sleep cycles. So go out today and plan out your next week and start to plan your meals, and then figure out where that 12-hour window sits and how you could first eat 1 to 2 hours after you wake up and finish eating a couple hours before you go to bed. I promise it'll go a long way to support your sleep, especially if you have CPAP or an oral device, or you've been diagnosed with sleep apnea, whatever type of treatment you have for the apnea. Having this consistent dietary pattern is going to support that. And that's part of what we teach with the 5 enhancements to your sleep with every sleep program. So if you have some more questions or you'd like some more information about this, please call or text the office. Be happy to help out. Hope you have a great day and hope this helps your sleep and your nutrition. And we'll see you on the next one. Thanks.